Like that.
We are going live now.
Great.
All right, we are live. Good afternoon. It's July 30th, Bariatric Friday. I'm here with Dr. Isaias Irgau. My name is Kemal Erkan. I'm the chairman of American Surgery Center. Our surgery center is the only MBSA QIP Center of Excellence for Bariatric. As most of you already know, we do this for our patients who are in the process of the bariatric surgery, as well as those who may be thinking of getting the bariatric surgery. So today, we are here again with Dr. Irgau, and then we are going to go through our topic. Today, we are going to discuss the day of the surgery, do's and don'ts. And then from that, we are going to have some updates, and then if there are any live questions, we can answer those as well. And I'm going to ask Dr. Irgau to introduce himself, and then we'll go from there.
Thank you, Kemal. Welcome, everybody, to Bariatric Friday. My name is Dr. Irgau. I am the president and co-founder of CHRIAS, or Christiana Institute of Advanced Surgery. My specialty is weight loss surgery or bariatric surgery, and I've been performing bariatric surgery now for almost 20 years. Along with my associates at CHRIAS, we are by far the most experienced group when it comes to bariatric surgery, not only in the state of Delaware, but also in the surrounding counties of the states like Pennsylvania, Maryland, and New Jersey as well. So thank you for having me. Kemal, appreciate it.
Thank you, Dr. Irgau. I'm just sending you an update to my my broadcast list, and you probably are going to receive that too. All right, so since most of the people, they already know who we are, I just want to make sure that they also know our other clinicians who are part of our team. Dr. Isaias Irgau as our president, and Dr. Gail Wynn, one of the most experienced female surgeon in the country. Dr. Mike Peters, who's been with us for almost 16 years now. Dr. Rose Singh, Dr. George Ibrahim. We have these individual surgeons on our bariatric team, and we have a colorectal surgeon, Dr. Sachin Vaid, who's been with us since 2015. And also we have 3 of our registered dietitians who are working with our team, our patients on a regular basis, day to day. As Dr. Irgau mentioned in the beginning, we have done more than 10,000 surgeries among 6 surgeons and more than 2,000 cases in the last 3 years. As we focus on more of these in our surgery center, we have to make certain choices, and we can focus on our patients in a better way, the way that our patients deserve, and the way that we want to make sure that we don't have any excuses for the best service. So we, since 2018, we provide our services at the surgery center. So we have done so many of these events, and you can find these events in our channels, on our YouTube channel, as well as you can see them on the Facebook and Twitter channels as well.
Kemal, I would like to say something about this. It's interesting. I had a patient coming in for consultation yesterday, and she told me she watched all these videos. And she said, I feel as if I know you because I've been watching all these videos already. So in terms of the educational value of this is actually excellent, Kemal. I know we go over some topics time and time again, but like any educational endeavor, it's not something that we are reading from a text. We are actually explaining things, you and I talking casually about it, but about very important things. So each session that we have presents a particular topic from a different perspective, and I think that's extremely helpful for patients.
So no, that's extremely important, Dr. Irgau. So even for us, like what we do for our day-to-day, when we have any issues, I mean, I personally do utilize YouTube videos before I look for deeper maybe help. I'm not saying that I'm replacing the help with the videos, but I want to have more understanding of the problem so then I can ask better questions to the clinician. So, I had a little dental problem last night and went to YouTube to make sure that I did what I needed to do. And I watched a couple of short videos and I was comfortable. And this morning, my dentist, Dr. Erin Radios, she's one of the best in Newcastle, Delaware, in Wilmington, her office is. She was able to accommodate us.
Nice.
And take care of the problem. But before I went there, I watched 2 small videos. And I was thinking about our patients, like what they would be doing when they have those types of questions, emergencies. And today, as our approach on our Friday session is smaller bites almost, and I'm not talking about the food bites, but I'm talking about the knowledge bite here. So we split these into, break them into smaller bites. So then you can actually watch the entire webinar on a Tuesday night with one of our surgeons, or you can actually just look at the topics in a shorter time period and just listen to these. And today we are going to do the what to expect on the day of the bariatric surgery. And it is, I should have said maybe on the topic that it's not just the day of when it's the bariatric. Our prep is a little bit longer for more longer than the day, and I'm going to leave that to you, Dr. Irgau, to explain. So if you can if I was the patient who's going to have the surgery, now just from our patient standpoint, that would my last encounter with the office would be about 2 to 3 weeks before the surgery with you, right? So with any of our surgeons. And from that time to the time of the surgery probably is a better question that I was thinking that you may want to kind of approach this answer, but I'll leave that up to you.
Absolutely, absolutely, Kemal. So as you mentioned, bariatric surgery is an extremely important, extremely serious treatment of a very, very serious illness, which is morbid obesity. And it is the most effective treatment that we currently have available for people who need to lose, 80, 90, 100, 150, 180 pounds for them to be healthy. As you mentioned earlier on, the process that we have through our program at the American Surgery Center really is geared to optimize this process in a way that the safety is enhanced, but the experience itself is also very, very good for the patient, right? Anytime one thinks about surgery, they don't necessarily think about having a pleasant experience, right? It's a treatment, of course. If they could avoid that treatment, they would wish they could do so. But if they have to have that treatment, obviously, why not have it in a way that is really as pleasant as possible for the patients? And so in our surgery center, first, let's talk about one of the issues that is mentioned time and time again by patients when they reach out to you, Kemal, to give you feedback on what their experience was like, right? So patients actually volunteer to write quite extensively about their experience, right? Now, imagine a person who has had surgery, right, to take time to write something about what their experience was. It takes a lot of really comfort with what has happened within the surgery center. And the key factor is that human touch, that human relationship, right? So everybody that is at our surgery center has one goal only, and that is to take care of that patient at that time, right? So that patient becomes the center of the universe for everybody at the surgery center. The staff that are going to be in the reception area, the nurses that are going to do the preoperative work, the nurses that are going to take the patient to the operating room, our anesthesia colleagues, the surgeons, of course, the physician assistant, the nurses in the recovery area, the nurses who will be discharging the patient, right? So that whole theme about being completely devoted and advocating for the patient, it shows, right? It shows in this type of reviews that you are getting. So we're not getting a review about a patient who had a wonderful meal at a restaurant. Come on, that's easy to write because it was a meal, right? they are writing about surgery, something that is not necessarily related with pleasure, right? So that we have accomplished, and you and I should be extremely proud about that, because it takes an extremely good team for that to be accomplished continuously throughout the whole process, from the patient coming to our surgery center until they leave the surgery center. So that human touch, that approach, that patients feeling completely comfortable in the hands of the people taking care of them, I think we've been able to accomplish that through the culture that we have inside our surgery center. So that's one, that human touch, that relationship that we've been able to accommodate. Now, one thing that obviously has given us an advantage in order for us to be able to do that is that we are a surgery center, Kemal. We are not a hospital, right? A hospital, by definition, has to take care of many different problems for many different people. And the people within the hospital have to be able to wear different hats at different times, right? Well, we are a surgery center that focuses on a specific issue, right? And that's where we are. So we don't have 20, 30, 50 patients coming and going through the day, right? We have one bariatric patient at a time, and that patient becomes the center of attention of everyone. That not only, of course, is critical for the outcome in terms of the quality, but also that comfort level, that human touch that patients perceive immediately when they get into our surgery center. So that's very important. And then there is the other issue that we focus on a lot, Kemal, and that is we focus immediately on the recovery side of the surgery, right? Because that's important, right? The surgery itself is undertaken with the patient under general anesthesia, so they are completely unaware of all the work that the surgeon and the assistant and the nurses and anesthesia are doing. But what about when they come out of anesthesia? Our work is really geared to making that recovery faster and also as pleasant as possible. And to be able to accomplish that, Kemal, we have a protocol that starts just before the surgery itself. In fact, most patients will come to the surgery center and they will be given some medications before the surgery that are designed to minimize discomfort after the surgery. They are designed to minimize nausea after the surgery. These are medications that are not available in other places easily, particularly the anti-nausea medication that, thanks to your efforts, we were able to get in our surgery center, Kemal, is a medication that we simply cannot obtain in the hospital. I mean, I have to be a cancer patient getting chemotherapy to be able to get that medication for nausea, Kemal, in the hospitals. But at the surgery center, our patients get it. And guess what? Very, very little nausea after the surgery, right? So those medications right there, right?
You know, not only it makes the recovery less painful, much faster, but also they don't have to stay overnight in the facility. Now, I think maybe the differentiating the surgery center from the hospital, I think what we also need to understand is, although we love our patients, we also know that their home is the best place for their recovery and then make them feel better. So I think we are not motivated necessarily to keep them longer. So sometimes staying longer may be more painful, right? So, and then that was one of the reasons that we wanted to make sure that we provided whatever is necessary, even if the cost is higher for us. But that was not our main motivation.
Absolutely, absolutely. That's key. That's key. Absolutely. There is no bed more comfortable than your own bed that you've been accustomed to, right? So when you're recovering from surgery, you want to be there. But we are able to send them to their bed comfortable, right? We don't want them to be requiring pain medication, strong pain medication every hour, every 2 hours, like what would happen in the hospital, right? Why? Well, because our preparation allows us to be able to have them leave our surgery center in that state of comfort and very little, if any, nausea at all. Now, we've given them medication, as I said, even before any of the surgery started, to prime them towards that situation. But then during surgery, there are certain things that we do differently as well that really enhance that recovery by minimizing discomfort. Now, clearly, one of the discomforts that a person experiences as they're waking out from surgery is their incision site, because there has been a cut in the skin, a cut in the muscle, a cut in the peritoneum. and that has been sutured back. But again, it's a site of trauma, and our body has been designed to alert us about trauma anywhere in our body by making it painful, so we can pay attention to it. Pain, however, is not pleasant, right? Pain also decreases the rate of recovery. In fact, if there is too much pain, the recovery rate is much slower, right? So there was a time in which we were taught that taking care of pain is important. Of course, we understood it, but we used to give so many strong medications for that, Kemal. And the medications themselves became worse than the pain itself in terms of really slowing down the recovery of the person. We would use narcotics, strong narcotics, that would put the patient completely to sleep again. Yes, they wouldn't feel the pain, but they're not up and walking. They're not recovering. In addition, those medications will cloud their mind, so they don't have clarity of the mind. Those medications will slow down the recovery of their digestive tract. So the medications became worse than the pain itself when it came to recovery. So we don't use any of those medications. What we use is something called TAP block, which is a very specific way of administering targeted numbing medicine into some nerves that supply the abdominal wall. We do this when the person is asleep, so they don't really notice us doing it. And yet when they wake up, they will have very little, if any, discomfort from the incisions themselves without any narcotic medication, right? So it is really rewarding to see a patient waking from anesthesia without any frowns on their forehead, because they're comfortable. If you see the frowns, it means they're uncomfortable, right? And yet you see them waking up from the anesthesia, no frowns at all. And so we're able to transport them to the recovery. What is peculiar about our recovery room, Kemal, that is that patient who's recovering will have one nurse at their bedside. That nurse will be spending all the time with that patient, knowing them, taking care of them, right? Informing them, communicating with their family, communicating with us, the surgeons, communicating with anesthesia. So it's a 1-to-1 ratio. Of course, it's very difficult to accomplish that in a hospital setting because by definition, again, the hospital has so many patients that you cannot have one nurse for one patient. You have to have one nurse for many patients. And that, of course, doesn't mean the nurses don't take good care of them, but it is different from having one nurse taking care of one.
It's the workload, right, Dr. Irgau? So like when you have, when you are on a floor of so many different rooms and you have to actually take care of so many people, then they don't have a choice. But in the surgery center, the whole issue is our focus is bariatric, and these patients do get the proper attention because just think about from the process of getting them ready for the surgery, how long time we spent and they spent, and the frustration and the clearances. So then at the day off, they have the most anxiety. So you and I, we do the daily case conferences with our team, and sometimes like we get frustrated on their behalf because process is painful. Now, I do want to talk about our new direction diet prior to the surgery. And I have some specific questions, perhaps that we can address those. Now, most of our patients, they do 2 weeks special diet. Yes. Prior to the surgery. Now, this is a meal replacement. So yes. It's kind of preparing their body in a way that once we are in there, we don't have any surprises. It's not just the weight loss, and maybe it is. So if you can kind of just address that, because I made a mistake the other day I assumed that I knew something and then I was wrong. So if you can actually address that for us, Dr. Irgau.
Absolutely, Kemal. So what we know is that when we become overweight, when we become obese, when we become morbidly obese, Kemal, one of the things that happened is a lot of fat tends to accumulate in the central portion of our body, which is our abdomen, right? And solid organs like the liver tend to have a lot of fat as well, right? In fact, many people will know that their doctors will tell them, yes, you have a fatty liver, sometimes even more serious than a fatty liver, just specifically because of the weight. Now, for us surgeons, this is very, very important issue. And the reason is simple. And I'm going to use a diagram actually to demonstrate that, Kemal. I know you have slides, but do you think my diagram is visible, Kemal? Can you see it really clearly?
Yes.
So it's a diagram of the digestive tract. It shows the food pipe, it shows the stomach, and shows the intestine. What we see here, Kemal, is the liver. Now, the artist has been very nice and shows a very small liver that hardly covers the stomach. Really, this is a representation that really doesn't reflect reality, particularly when we are obese. When we are obese, in reality, the liver is large and it covers almost most of the stomach, right? So in order for us to do the surgery on the stomach, when we divide it, for instance, for the sleeve, we have to push away the liver and retract it so we have complete visibility. But think about it. If the liver is very heavy, laden with a lot of glycogen, a lot of fat, it's going to resist that attempt of us pushing it, right? It's also almost going to behave like a piece of stone, essentially. So if we force it to push away, then we can injure it, right? And in some cases, come on, if we don't do something about it before surgery, we may not be able to do the surgery at all. In fact, I remember I had a couple of cases about 12, 13 years ago of patients who did not go on this diet, Kemal, that I got in, but I could not finish the surgery because I could not see the stomach and I could not safely push the liver away. So what we do before surgery is we put people on this special diet called the New Direction diet, which, as you mentioned correctly, it's a meal replacement diet, which means that you cannot eat anything but that. It is complete in its nutritional content. It has all the vitamins, it has enough protein, but it is low calorie. And it's actually designed to be very filling. That's actually a good picture of a fatty liver, right? So what it does specifically is when people are placed on that diet for a couple of weeks, yes, they lose weight, but a lot of the weight is lost from the visceral fat, which means the liver becomes nice, soft, and thinner. So when we push it up for us to expose the stomach, it follows us easily. No problem at all. So we are able to retract the liver and complete the surgery easily. So when we ask our patients really to go on this diet, yes, we know it's a tough diet sometimes, right? Because you're not eating anything else. And you and I have done that diet many years ago, Kemal. You remember, right? The first 2 days are the hardest, but after that, it actually becomes easy, particularly if you drink plenty of water as you're doing that. You have to stay very well hydrated. You don't feel too much hunger because it's filling, but it helps us, absolutely. It helps us greatly because the liver is shrunk and the surgery can be done safely. As you know, sometimes we ask certain patients to go actually on a 3-week New Direction diet rather than 2-week, and that would apply, for instance, in situations where the body is really at such high levels, particularly in men, where we tend to accumulate most of our fat definitely in our waist, right? So we ask patients sometimes to be even on 3-week diet, and it's obviously something that is demanding on them, but with good education, the vast majority of our patients are completely compliant. In fact, interesting, when I see them in the pre-op area just before the surgery, the first thing I ask my patients is, hey, how was the diet? And many of them will say, oh, I did it. It's over. And I say, thank you. Very often they will tell me they've also lost 12 pounds, 15 pounds, 18 pounds. That gives me an idea of how much the liver has shrunk. And the first thing I do as soon as I enter the abdomen, Kemal, is to inspect the liver, right? We look at the liver and see how well it has done. And with this diet, invariably, we will see that the liver is nice and small. We can push it away easily, and then we can perform the surgery safely.
Yeah, I think there's that misconception of the diet, just dieting and losing weight before the surgery, but that's just one of the result of it. But the main thing is shrinking the liver prior to surgery. So we are prepping the body. Now, just so that everyone kind of have an idea, the operation itself takes about like 60 to 90 minutes. But from the time that you start with the prep area, from the time that you are in the prep to the OR, that takes like a couple hours, but you are discharged on the same day. your
Yes.
recovery time after the surgery is between 6 to 8 hours.
Yes. Yes, it is.
So in our surgery center, we had maybe 3 or 4 out of 280 cases last 12 months that we have hospital transfers.
Yep.
So those were rare cases that we have, but it does happen. But the main thing is understanding how the process that we are going through, how much we have to do, the team. Like I designed this system for us, the database that keeps outside of our electronic medical record, we are able to keep track of everything that we do with the patients, step by step, each different things that we record, and the safety net is extremely high.
Absolutely. Absolutely.
So once the patient is there on the day of the surgery, we feel extremely confident that patient is in the safe setting. Now, the only other thing that we have is for those who are with the COVID-19, if you are vaccinated versus if you are not vaccinated. Dr. Ria, if you want to just maybe address that one as well.
Absolutely, absolutely. So as you and I have discussed many times, the virus has not left our community, right? There is still COVID-19 in circulation, and we have to be able to protect our patients and also our staff as we continue to perform surgery in this situation. So for people who are fully vaccinated, we still ask them to be tested because being vaccinated doesn't prevent infection, although the infection may not be noticeable or it may have a mild illness, right? So we want to know. So that is the rationale. But in the past, we used to ask patients to get quarantined, right? But if they are vaccinated, we don't require patients to be quarantined any longer. Come on. Now, for patients who are not vaccinated, the situation is different. Remember, one of the reasons the rates of the infection are continue to go up or lingering where they are is because the vaccination rate has not been as high as we would want it to. So if somebody is not vaccinated, we not only we want them to get tested for COVID, Kemal, but we also want them to quarantine for 7 days prior to surgery so that they don't expose themselves to the virus. And one of the important factors that we have here is we do not want to perform elective surgery on somebody who is actively infected with COVID. That's obviously very important. And that's why we have those guidelines in place to protect both our patients and our staff.
Absolutely. All right, so just wanted to remind everyone that we have our set events on Fridays, our Bariatric Fridays. In the next couple of weeks after we try this at 1 p.m., we may adjust the time based on Dr. Irgau's hospital schedule. And then we do have our second and fourth Tuesday at 6 p.m. Full webinar. Actually, if you want to see the entire process, you should definitely watch those. We have our updates from UMACO. Today we did the Delta variant, and there are several different updates that we go through every week. And Wednesday wellness webinar is from our diabetes center, and there's also a diabetic support group for UMACO patients, and this is an exclusive event. And if the only thing that I think the website is misspelled, so we'll fix that. So you can always reach out to us from these. Now, I think that's all we have for today, Dr. Irgau. I don't know if you want to add anything. I know you had a long day today.
No, Kemal, I think this is great. This is one of my favorite things to do on a Friday. I can tell you that. So, no, I think it's important for us to continue, and I'm encouraged by the feedback I get from our patients about how important they find the information that we have here. As you mentioned earlier on, the information that we present here cannot replace the individual consultation that the patients will have when they come to see us, because everything that we talk about here is in a general way. So, but what applies to any particular patient, that has to be determined at the time of the consultation when the patient will come see one of our surgeons, and then of course, every decision and determination will be based on the specific and peculiar circumstances of that patient.
All right. Well, Dr. Irgau, thank you so much. And thank you for joining us. And we'll see you guys.
Thank you, Kemal.
Thank you. Bye-bye.
Thank you. Bye-bye.